Let's get back to the kids' vaccine rollout in the United States. Joining us now is Dr. Kavita Patel, the former White House policy director and fellow at the Brookings Institution. And Kavita, we were just talking about this rollout. I guess it could happen as soon as this week. Kids would be able to get vaccinated. Is that what you hear?
Yeah, Becky, listen, some of the pediatric offices I've talked to said that they're being told to be ready Wednesday, which is a little too soon to believe just because the CDC makes their decision and then Pfizer obviously can ship some of those special sized and colored vials. But getting that ready for shots in arms by Wednesday seems ambitious, but people are actually ready and willing. And there are already appointments being filed and made for as early as this Friday, Saturday, and Sunday for first shots.
I think about it that many of the doctors' offices that I've spoken to, at least, have been a little concerned because, you know, they haven't been in the process of giving these shots. They give flu shots, they give other vaccinations, but these are a little different. Could you expect that there will be a few weeks for trying to iron out some of the kinks there?
Absolutely. Even in my own clinic where we do give pediatric vaccines on a routine basis, we're having to walk through, and especially because we're giving first shots for flu and all the other regular immunizations to children. And then we're having to kind of follow these special instructions, not that special in the scheme of COVID vaccines, Becky, but special for pediatric COVID vaccines, which many of these pediatric offices have not been giving. So you're exactly right that I would truly expect for most parents to think about their children if they're eager to get vaccinated over the next several weeks, certainly before Thanksgiving, but not as early as this weekend for most of America.
You think places like a CVS or another pharmacy that's already been giving COVID shots to adults would have a better chance of ramping up more quickly?
They do, and that's what a lot of, I think, as Meg covered, that health departments are kind of trying to use a multilateral approach, schools, pediatric offices, and pharmacies. I know, for example, in the District of Columbia, pharmacies are an incredible strategy because they are used to giving them. I have talked to parents, though, Becky, that say, you know what, I really want to have this done in my pediatrician's office. They're my trusted place for vaccines. Plus, some of them want to talk to the pediatrician or some of the staff just to get their advice, and I think that's totally reasonable. But most pediatric offices are telling patients, don't wait to get an appointment with us. It might be several weeks. If you can get a shot, get it at your local pharmacy. We'll still talk to you, but don't wait for an appointment with us. And I think that's good advice.
Hey, doctor, wanted to ask you, maybe this is it's happening at every family's house. So maybe it's selfish, but I'm just going to ask it. And it's, I think, where Becky was going earlier in the conversation with Meg, which is once the kids get the vaccine, all they want to know is, can they take their masks off?
Right. Right. Yeah, Andrew, that's the trillion-dollar question. And I think that to be responsible, you really want both doses, right? We know children, by the way, 5 to 11, have incredibly robust immune systems. So there's no comparison between a 5 and a 50-year-old. And we know that there is some immunity that's afforded into adults after that first shot. So we know that that can be helpful. But I would definitely say 2 shots, 3 weeks apart. And then certainly we would recommend a week or 2 after that second shot is when I could safely convince anybody that you can remove that mask in an indoor setting and likely to be safe. I will say, though, I don't think schools are going to get rid of masks anytime soon because we're not going to have an even uptake rate. And we don't want to repeat some of the mistakes of the past where we pull this back and then see an outbreak or a surge. So I think in your household, though, Andrew, it's totally reasonable. If everybody else is vaccinated, even that child that's vaccinated can safely take off their mask.
The second question goes to this issue of breakthroughs, which is to say we are seeing the levels come down in terms of Delta. So that's the great news. But then we also keep hearing about these high-profile examples, Jen Psaki and Bon Jovi being the latest in terms of breakthroughs. So how do we think about that? And again, the issue of masking inside or not?
Yeah, I'm going to give you a little bit of good news, bad news here briefly. I think the bad news here is that these breakthroughs, at some point, we're going to start to become used to that the more immunity we have. Because think of this as the kind of disease where at some point in our lifetime, Andrew, all of us will probably get it once, twice, or maybe several times. The goal would be to be immunized so that when we do get it, it's mild, asymptomatic, doesn't even bother us at all. It's just a diagnosis. So I do think that you're right. And it also marks to me that we do need a heightened kind of monitoring system. This is the good news for breakthroughs so that we can understand what's causing the breakthrough. Is this a variant that's escaping immunity, or is this something natural that we would expect because this is just a virus that's going to work its way around the population? But something to be aware of, especially if you're high risk with chronic conditions, as we only have about 60% of the country vaccinated. And then hopefully over in the next year, this will become a little bit more normal and not as threatening to the kind of activities of the public. But it shouldn't hold us back from being confident in the vaccine itself, including taking off masks eventually.
Shepard Smith here. Thanks for watching CNBC on YouTube.